Mrs. Watkins?
Yep, that's me.
Hi, I'm Nabila. I'm the pharmacist here today. I just wanted to have a word with you about your medication. Would you like to see?
Sure.
So now the doctor's prescribed you Zenacal. Have you used this one before?
No, I haven't.
Did you tell me what you were using it for?
Yeah, I did tell him that I was putting on way too much weight and I was worried about it, so...
Well, that was exactly what Zenacal's used for. It's actually for weight management, to help you reduce your weight. It doesn't suppress your appetite. The active ingredient, orlistat, what it does is that it absorbs the extra fat in your diet. So by doing that, by decreasing your fat absorption, you'll hope to decrease your weight. Now the doctor's put here, take one capsule 3 times a day. With that one, take with a full glass of water, but you take it with your 3 main meals, so take it with breakfast, lunch and dinner, because that's how it works. It decreases the absorption of the fat in your meal.
Okay.
So if you don't have a fatty meal, or if you know that your meal contains no fat, don't take the tablet because there's nothing for it to work.
Okay.
And if you miss a meal, there's no need for you to take a tablet. Taking extra of this actually isn't going to benefit anymore, so just stick to the recommended dose, so taking 1 tablet with the meal. Just with that one, because like I said, it decreases the absorption of fat, it will also decrease the absorption of the fat-soluble vitamins, so you do need a supplement. They always recommend that you take a vitamin supplement just to increase what you've lost. And generally you'll take that 2 hours before or 2 hours after, because you don't want to affect the absorption of that either.
Okay.
With Zenacal, you'll find that you'll get an onset within about 2 weeks.
Okay.
Okay, and you do need to take it for at least 2 to 6 months for it to be fully effective. By using weight management, by losing weight, I mean, it manages all the risks. Your cardiovascular risk will decrease, so that's really good with that one. Just with Zenacal, there's a couple of, not many, it's very well tolerated, not many side effects with that one, but you may experience a couple of maybe nausea or indigestion. Abdominal pain is also one that is common, but with time, you may develop tolerance to those ones, so then they can just pass. One of the main side effects, however, is that you will get fatty stools. So that's like oil deposits in your stools, and well, that's understandable because it's decreasing the absorption of your fat, so technically you'll be excreting more. Just with that one, the higher fat intake you have in your diet, then obviously the higher you will excrete, so you need to be wary of that. It can be a bit uncomfortable depending on how much fat you're taking. Okay. Zenacal works in combination with a well-balanced diet, so I would recommend that you need to stay away from high-calorie foods like chocolates and sugars and all those high fat intake, because you're essentially trying to lose weight, so that's really not going to help you lose much weight.
Okay, so that means if I feel like I want to eat some chocolates, I can't just eat chocolates and take a tablet with it?
No, it's not going to work. Essentially, it doesn't work that way. You need to stick to a well-balanced diet. My recommendation is if you want to snack, probably go for a fruit. Generally, we advise that you need to have 2 and 5, so that's 2 fruit and 5 vegetables a day. So if you stick to that, on that with your snacking, you'll be able to incorporate that into your diet. So that should help. There's also here, like I said, on page 4, it's actually a website that you can go to. It's a national health website, and you can look up there, and they've got a table of how you can have nutrition, and you can correlate that with your diet and see what you can include into your food. Okay,
so in 2 weeks this will actually start reducing my weight?
Well, the onset of action is in 2 weeks, and you'll find that you'll get a reduction in absorption of weight. You also need to have a number of factors that will include in helping you lose weight. So, like the well-balanced diet that I told you about. Exercise is always a good factor. Cut down on your alcohol if you drink alcohol. And increasing the fluid, mainly water, that will help you in your weight management.
Okay, so I sometimes exercise. I walk for like 5-10 minutes, or run for 5-10 minutes. That's enough, or is that, I don't know?
5 to 10 minutes is generally not the minimum. The minimum we say is 30 minutes. So if you do that exercise for 30 minutes, that's a good start. You can always increase to more, but 30 minutes is a good start.
Okay.
Any other questions?
No.
No, just with that one, I've dispensed that one, so as you can see, all the capsules are in there. It's a 4-week supply, so you'll just take your tablets as you need it. I've also printed you information about that, so that's just the CMR, which you can read at a later date. Our number's actually on the box, so if you need anything, just ring up and we'll be happy